From the Daisy nominations received during the month of April, the winner is Laura Lemke. Laura has received 12 nominations since the program began. When the nomination is not chosen as a winner, it is saved until another nomination is received and resubmitted to the voting panel of direct care nurses. This allows the voting panel to read the complete story about the nurses caring. The nominations. Nomination 1 from May 2012. During my stay on oncology unit at Mother Francis, Laura Lemke was my nurse for 3 nights. I found Laura to be extremely kind, compassionate, and so very thoughtful. The nights when Laura was in charge of my care, I got a wonderful night's sleep, which is a rare occurrence in a hospital. She meticulously monitored my IV pump and fluids so the dreaded beeping was avoided, and I was rarely awakened. One night I developed a painful sinus headache. Although Laura offered to call my doctor to request medications to be ordered, we decided to go with her suggestion and use hot compresses to relieve the pressure and headache instead. She was so very attentive and helpful. My headache eventually subsided. She is a treasure. Nomination 2 from July 2012. Laura went the extra mile to care for me. She's very polite and always smiling. She would help me in any way possible. She would respond quickly when I needed her assistance. Nomination 3 from September 2012. Laura Lemke has gone above and beyond. She's extremely professional, compassionate, and loving. It's truly been a pleasure having her as a nurse. If every nurse like her had, all of your patients would be blessed. Nomination 4 from November 2012. Laura is always happy and a bright ray of sunshine. No matter how hectic her day is, she always takes the time to be sweet and positive with her patients. If there were more nurses like her, the patients would get well faster. I just love her and her attitude. God bless Laura and her nursing care. Thank you. Nomination 5 from January 2013. Laura has been great. She has been very helpful in explaining things, very prompt and very efficient. Nomination 6 from January 2013. Laura is very polite and caring. She puts me at ease because I can tell she knows her stuff, and that makes me feel safe. In addition, she makes sure all my needs are met. Nomination 7 from February 2013. Kind, gentle, and caring are perfect words to describe this amazing nurse. She always tries to help. She always took personal interest in my mother's care. I'm so grateful for every day she came into my mother's room. Thank you for giving me the opportunity to express how wonderful she is. Trinity Mother Francis is very blessed to have her on staff. Nomination 8 from February 2013. Laura is extraordinary. She is one in a million Daisy, and that's hard to find. Her skills, her kind heart, her laid-back ways are incredible. She is well put together, both person and a nurse. In addition, I might say that I'm very hard to impress. Nomination 9 from March of this year. Laura provides excellent, efficient service. She is very cordial and caring. I have been very pleased with her exemplary service. Thank you so much, Laura, for showing how much you care about your profession and your patients. But most of all, thank you for caring for me. Nomination 10 from April. I would just like to say that Laura shows more care and concern for my needs and me than anyone I have ever met. I can tell that she has love in her heart for her patients by the way she carries herself and is always comfortable and answers the questions that I ask. She has a positive goodness that makes me feel safe when she's administering the many medications that I need. I thank God for putting her briefly in my life. Nomination 11 from April 2013. Laura's kindness shows her love for her work in helping others as patients and persons. Her one-on-one attention towards me gave me a feeling of confidence that I was looked after by one of this hospital's best nurses and caregivers. Her smile and warm-hearted sense of dedication to my needs and care took me by surprise. I must admit that God appointed her with the right job in her life. And nomination 12 from April, Laura is the sweetest nurse I know. She went out of her way and then some. She made me feel at home, even though I was in the hospital. Thank you for everything. God bless you. Now it's my pleasure on behalf of the Daisy Foundation to proclaim you, Laura Lemke, a Daisy Award Extraordinary Nurse. Here is your award certificate. And I would like to read what it says. This award is presented to Laura Lemke, BSN, RN, in deep appreciation of all you do, who you are, and the incredibly meaningful difference you make in the lives of so many people. And I would like to present you with your Daisy pin.
We already lectured him about stabbing.
Right.
I don't know. If I mean to him, he may try to get back at me.
I want you to have this sculpture as a symbol of your recognition today. And the banner will hang in our unit this month in your honor. Then the ever-popular parking pass, in which the winner has a free reserved parking in the garage for 1 month. And it was delivered, it says that it would be later, but. Now a message from the Daisy Foundation. By definition, the Daisy Foundation thinks all nurses are extraordinary. And we wish we had the resources to honor all of you individually. Nurses who receive the Daisy Award often say, everyone in the unit deserves this, or I don't deserve this, I was just doing my job. What the Daisy nurse may not realize, however, is that when nurses are just doing their job, they have such an important and meaningful impact on the lives of so many people, so many more than just the patients. At every Daisy Award presentation, we ask each nurse to pause for just a minute and realize how very special they are and how they make the world a better place. Thanks to your education and training, your commitment and judgment, your compassion and connection with your patients, you are very special. You make the world such a better place by just doing your job. The skill and compassion that you bring to patient care makes the patient's outcomes more positive and makes family members feel a little bit better and able to help patients with their healing. Think about the impact that you're having. Story after story brings this to light. I would encourage you to look at the National Daisy website and read the stories. The link is on the Nursing Public. Prior to our closing prayer, I want to give a special thank you to all of those that nominated Laura. This award does not happen unless you take the time to write the nomination, and it means a great deal that you care enough for Laura to do that. Thank you for choosing nursing as a career and for the skill, compassion you give to your patients every day. To Laura, congratulations.